Welcome to the MultiCultural Mindset broadcast. Your host is Dr. LaVerne Collins, a licensed professional counselor, award-winning trainer, and keynote speaker. Dr. Collins is the author of Overlooked: Counselor Insights for the Unspoken Issues in Black American Life. Dr. Collins has also been a featured monthly columnist in the American Counseling Association's Counseling Today magazine with her Honoring Diversity column. Now, here's Dr. Collins.
Hello, everyone, and welcome to another episode of the Multicultural Mindset, where we're exploring all things related to the mental health of people of color and other marginalized communities. I am your host, Dr. LaVerne Collins, and as always, I'm so glad that you're here today for our conversation. Our goal is to present you with topics that help counselors serve people of color well. I want you to grow into a multicultural mindset and further develop a multicultural mindset that just makes your counseling culturally attuned for a diverse range of cultures and backgrounds. And today we're specifically talking about the maternal mental health of people of color. And I am so excited to have one of my sisterly colleagues in the counseling profession with us today, Dr. Kristy Christopher Holloway. Oh, Dr. Holloway is amazing. She is a counselor educator, as well as the founder and director of New Vision Counseling Center and of New Vision Consulting and Training, both located in Georgia. She is a licensed professional counselor, a licensed clinical mental health counselor, a national certified counselor, and a board certified telemental health provider. She is also a clinical supervisor, and she is certified in perinatal mental health. This topic is so important because America's perinatal mental health situation is just not good, especially when it comes to women of color. But Dr. Holloway is not just doing her thing in the counseling rooms. She is the immediate past co-chair for the American Counseling Association of Georgia, and she is the 2023 to 2026 Association for Multicultural Counseling and Development Southern Region representative. And this is how committed she is as a counselor. She is the incoming 2025-2026 president-elect for the Association for Multicultural Counseling and Development. Now, let me say more. See what I mean? She's amazing. She is a faculty trainer, a curriculum manager, and a subject matter expert for Postpartum Support International. She works with racial and ethnic minoritized women who are experiencing infertility trauma, birth trauma, reproductive loss, and issues related to perinatal mental health. In addition to being, check this out, I told you, she's amazing. In addition to being a celebrity therapist on season 13's The Real Housewives of Atlanta. You see what I mean? She's just a phenomenal human being and an amazing contributor to the profession of counseling and to the community at large. She is a national and international speaker, focused on topics such as African Americans and mental health, psycho-emotional impact of infertility in African American women, perinatal mood disorders, the strong Black woman syndrome, generational trauma, and cultural competence and humility. She's the recipient of numerous awards and honors, including the Breakthrough Award for Counseling Research, awarded by the National Board for Certified Counselors, recognizing her work related to mental health and infertility. She resides in the metro Atlanta area of Georgia with her husband and her three beautiful children. So please help me welcome Dr. Kristy Christopher Holloway. I want to dive right in. Welcome. So glad to have you.
Thank you so much. Thank you. You know, I'm always excited to be in your presence. So anytime you call on me, Dr. Collins, I'm coming. So, for having me, and thank you for having this podcast.
Well, the feeling is mutual because I always learn from you when I'm in your presence. So I appreciate the mutual respect. I'm going to ask if you would start by telling us a little bit about your own story as an African American woman, as your journey to birthing or motherhood. I know your story has a lot of different facets that really contribute to your passion for this topic around maternal mental health. So, what's been your journey in this area?
Yeah, it has definitely been a journey for sure. And I think it's one of those things, well, to make a long story short, because it's a story and it's definitely a journey, but my husband and I struggled with conceiving. So we experienced infertility for over 3 years. And, in this process, I'm in school, I'm working on my doctoral degree, I'm seeing clients, and I knew some things were going on and kind of some of the experiences that my clients were having, also some of the experiences I was having, but didn't know any of the names to it. Didn't know the overall impact of what I was experiencing, and so we finally were able to conceive through fertility treatments, and went through that process. But even in that, I didn't know, again, what is this impact? How does infertility or fertility challenges impact a person? How does this impacting me? Because now I'm pregnant, yay, things are good. And at least in my head, right? Things are going to be good and all of the things, and not even realizing, okay, well, now there's the anxiety in trying to stay pregnant. And then there's the anxiety in getting to a full-term birth. And then there's the anxiety in now, how do you want to parent and mother and all of the things? And still, again, trying to figure that all out, navigate all of that. I'm now seeing clients who are experiencing, again, trying to conceive or just this whole matrescence or motherhood journey. But again, didn't know the name to it, didn't know all of the things. I had taken a training on perinatal mental health, and it was really perinatal mood and anxiety disorders, right, through Postpartum Support International. And so my research was also on the psycho-emotional impact of infertility in religious or spiritual African American women, because I wanted to see how were we coping, or how were they coping with an infertility diagnosis as a Black woman, because the representation was not there, and it still is very scarce. So, you're Googling infertility in women and you don't see anyone that looks like you. You're trying to go to appointments, you don't see any woman or any babies or doctors that look like you. And so it felt very isolating and very shameful and very, silencing in a lot of ways. And so I'm doing this research, also the religiosity and the spirituality, the component that comes with that, depending on your belief systems. What does it mean to be fertile, right? To multiply, fertile and multiply. What does that really mean? What does it mean? What does religion say about children and children being a gift from God? And then how am I processing that if I'm not unable to have this gift, or if my gift was taken away? Right. And so all of the things that just kind of come along with that. And so I wanted to see what those help-seeking behaviors of this population were, and then the impact that it was having. And then in 2018, I experienced a medical crisis that had me in the ICU, and on my deathbed. So really a near-death experience. My children at this time, my twins were 3. Had just turned 3. And I remember laying there like, God, I can't die. Don't let me die. Who's going to do this for my children? Who's going to do that? Now, way back on it, like out of it, I can kind of joke about it. And I'll even say I could even die at that time, because here I am, a Black woman on my deathbed, thinking about all the things. I can laugh about that piece now, but literally that was happening. I can't die because who's going to do this? What about that? What about my children? Who's going to raise them this way? Are they going to give them the almond milk because we don't do dairy milk? Are they going to cloth diaper them? We don't, like all of the things that we were doing. And so in that process, once I thankfully made it through and came home, my dissertation research was approved. And I'm sitting here like, I am my research. I am all of these things. I was already it, but I am really my research. And that's a complicated place to be in. You know, if you've done any doctoral or any research period, right? How do you bracket out? How do you remove yourself from this research, but also being a part? Many of us are researching those things that are important to us. So how do you connect to it, but how do you also disconnect to it? And me being so fresh out of that experience, it's like, what does this mean and look like for me? And through that, I also recognized that I was experiencing a lot of anxiety and a lot of depression, even prior to that. And it didn't hit me. I'd been going to my therapist about my own fertility journeys, my own upbringings, my own transgenerational traumas, and, you know, all of those things. And I love my therapist to pieces. You know, she had a training in infertility, she had training in women's issues, and I do that, the air quotes, because it's going to be helpful as I continue to tell this story, and talk about just the needs of this population, but women's issues. But it wasn't until my 5.5 months that it hit me that I was experiencing. I was like, this is depression. This is postpartum anxiety. And I did not know if, even though I was in this, even though I was in the training, even though, you know, like all of the different things, I did not connect and realize. My therapist and I didn't pick up on it. You know what I was told, like many Black women, you got a lot on your plate. You got a lot going on. You are wearing multiple hats. At that time, again, I was working on my doctoral program. I was a new mom of twins. So of course I'm going to be tired and exhausted. I'm breastfeeding, I'm cloth diapering, I'm working on my doctoral program. I also have a private practice. And at that time, the practice had 2 separate locations. So I'm back and forth to that. And so a lot of my exhaustion, a lot of my responses were applied to, you just got a lot going on. Right. And so it was a while. It was 5 months in. My children were 5.5 months before. It was like around Mother's Day weekend, I believe. And I remember saying, this is that. This is what this is. And so then I go back to my therapist, like, hey, this is what's going on. That led me to also understanding the need for quality training and understanding, because it looks different. It looks different in different populations. The perinatal piece looks different in various populations, but also how we show up and how we show it is not going to manifest as perhaps I'm depressed, or I'm laying down, or I'm so anxious I can't get anything done. It may look like overindulgence in work. It may look like I have everything organized and in order, right? It may look like all of the things, right? What is driving us? What is controlling? And so, you know, fast forward, I, you know, do all of this stuff. I have the children. I figure out what's going on. I have this medical crisis. I'm doing my research. I, through the grace of God, make it through that, because there are days I'm thinking, how did I even get through that? Right? How much did I have to disconnect to be able to complete that research, while also dealing with my grief, my anger, my hurt, my confusion, all of the things as it related to my own health crisis. Move through that. And then divinely, I get an email saying, hey, we keep hearing your name. Will you consider being a trainer for us and contributing to Postpartum Support International, which is how I kind of got through that and learned even more throughout my experience on now looking at fertility challenges and infertility, and that understanding that that is a risk factor for experiencing a perinatal mood and anxiety disorder. So postpartum depression, postpartum anxiety, OCD, right? All the things that I have to do, all of these different things. And so that's just kind of like the shortest version of a long story that I could kind of put out there.
Certainly, with everything I'm hearing and everything I know about your journey, you have experienced at every stage of the process, you've overcome a hurdle.
Yeah.
Physical hurdles, emotional, I mean, all of that. So you are well prepared to sit next to someone, sit across from someone, and empathize and understand and hear and respect and validate and let a person know that you see them, you see
Ab-
that struggle. And when you
Absolutely.
spoke about the Christian, what felt like for you Christian pressure.
Yeah. That religious mandate, that
Wow.
religious mandate that comes to be fruitful and multiply, right? Now, pre knowledge and understanding, to me, that meant to have children, populate this earth, right? That is a religious mandate. I'm not thinking be fruitful in the love that I give, be fruitful in how I sow into others, be fruitful in the knowledge that I share to others, right? For me and for many folks, that is a very literal meaning.
Literal, physical,
Yeah,
regenerative, populate kind of a
absolutely.
mandate.
Absolutely.
Mhm.
Then you hear children are a gift from God. Okay, well, where's my gift, Lord?
Mm.
I'm gonna give you the desire, will give you the desires of your heart. You know the desires of my heart. What's going
Where
on?
is it? Yeah. Mm.
For folks who have lost babies, well, wait, what kind of God gives you a gift and then takes it away?
Mm. So
Right?
they blame God for what was a physiological and I'll just pause and say this. That is not at all uncommon in the historically Black church,
Absolutely.
where literal expectations and holding God accountable for the bad things that happen. That I find that to be unfortunate because my faith perspective doesn't hold God accountable for the things in the earth that happen because we live in a broken world.
Yeah.
But I
Yeah.
know that that is a struggle for a lot of people, because we've been taught that God is in control of everything, put everything in God's hands, and God will always give you, and God will, and so whenever our experience is not meeting our expectations, it cannot also become a spiritual crisis.
Absolutely. Absolutely. And that's one of the things that I talk about too, because we will see that folks will go through this spiritual or this faith crisis. And it always takes me back to the training that I did with you in 2018 on using cognitive behavioral therapy or therapy and working with clients who are angry with God. And I had just come, and I don't even know if you knew at that time, I had just come out of my medical crisis. I was still on medical leave. I know that much. And I came to your training. I had signed up for like that one day, and then the next one is happening. I'm like, is it too late for me to come to tomorrow's? Because I was wanting to learn, but I was also healing in that training. Well, I was learning about me in that training as well and healing through, because everything you were talking about is what I was experiencing. I was extremely angry, extremely confused, extremely upset. Like, how do you put me on my deathbed? How do you take away my ability to have more children? This is in my thought process. How did you put me through this to suffer? And my children almost lost their mother. My husband almost lost, his wife, my family, like all of this. And so and you talked about how sometimes our view of God shapes how we are experiencing, these life journeys and life experiences. And so I still apply that to this day with the clients that I'm working with. I just told my intern about it about a month ago. I was telling him about you in that training, because it really shapes how we are supporting our clients, and how, especially if religion and spirituality are important to them. And in a lot of Black people and people of color, it is in some form of fashion. And so now they are going through a spiritual crisis or a faith crisis based on this view of their higher power and how they are experiencing or making meaning of this experience.
Yeah.
And so I think that's very, very important, especially if we're talking about the quote unquote Black church.
Yeah. Yeah. Thank you for sharing your story. And by the way, that cognitive behavioral therapy for clients who are angry at God is coming back up in just another month or two. So I'll be posting. Yeah, I'll be letting people know about that learning opportunity. So we are in we meaning women of color, particularly Black women in America, are very much in a maternal perinatal crisis. Well, and it's not even an acute crisis, is it? It's just it's an ongoing struggle with medical racism
Right.
and less regard for Black life. What are some of the systemic factors, racism, healthcare disparities, socioeconomic things that are
Yeah.
impacting Black maternal mental health? Tell us the story. Give us the picture.
Yeah, absolutely. And it's a lot of the things that just even mentioned. A lot of those barriers or a lot of those factors really start with the racism and the implicit bias that is present in our systems, in our healthcare systems, our mental health systems, our education systems, right? How are we training folks? What coursework and materials are they being trained? And is that material bias? Is that material, does it have microaggressions and those subtle racisms and isms, ageisms, all the different isms, right? That folks in marginalized communities and populations experience. How are they even being taught? So definitely that medical racism and implicit bias. Black women, women of color, their pain being dismissed or minimized. I can, tell you countless stories of folks who would tell me, my doctor said, well, there's no way you can be in pain because you're talking to me.
There's no way you can be in pain because
There's
you're talking to me.
that much pain because you're talking to me. And you're just
Medical
talking to me.
medical doctors actually say that to a woman either in labor or in childbirth or during pregnancy. They literally say that to someone.
Yes. Yes. Or, they're constantly saying, hey, something is not right. Something feels off. Something is just not, I don't feel right. Okay, well, you just gave birth. It's okay. You just gave birth. You're not expected to feel right. So I'm not, not being checked or assessed. I have a friend, and this happened to her after birth, and she kept saying, I don't feel right. I don't feel right. And it was after she passed out for the third time that they finally checked and did what they needed to do and saw that from her C-section, there was a part that wasn't closed up right. And so some internal bleeding was happening. And so it's, why did we have to get there, right? And so now the crisis that she's experiencing as it relates to that. So we know this, right? We know how they are dismissed or minimized. Black mothers are often more likely to have their concerns about mental health ignored or downplayed. I can tell you stories about folks who say, hey, I gave birth and I wasn't checked on much because they told me I was a good patient. I was one of the ones who wasn't pushing my call button a lot, and I wasn't doing this. But what I really felt was alone and isolated, and no one cared because this person's partner had to go, to work, or, take care of the other children, check on the other children and things like that. So they weren't in that room with them 24/7. And so she's saying, I felt just ignored. No one cared for me. No one checked. That also meant no one was checking in on her mental health. No one was checking in on how are you navigating? How are you feeling? That also means, because this goes even further when we talk about the lower rates of breastfeeding in Black women too. So where is lactation? Nobody is here to support me in latching my baby. No one is here to support me in understanding that, hey, maybe I'm not supposed to be having milk just flowing, and all my baby needs right now is colostrum, this little bit. And now I'm over here stressing, thinking I'm supposed to have milk just pouring out, and it's not. And now I think I'm inadequate. So we're not checking my mental health. You're not checking lactation. You're not checking my pain and my comfort. You're not, do I have any questions? All of that. And so now, before I even leave the hospital and go home, I'm already stressed, neglected, run out.
Feeling inadequate, even.
Inadequate, right? Places we're supposed to be able to go, which is why a lot of people are choosing to birth in birthing centers, birth at home, or are having different birthing options. I'll say that. Because this is a place I'm told I'm supposed to be able to go, but nothing's happening. There's no care. There's no follow-up. There's no one coming through. And so we see those instances as well with being ignored. We have those socioeconomic barriers that are there, with Black women being more likely in some cases to be uninsured or maybe underinsured. And so what does that look like if we think about some of the cuts that are currently going on, just with the current administration, how things may be changing, how people are concerned about those changes. So what does healthcare access look like? Insurance look like? I literally, right before we started, was just reading a post saying how healthcare is cheaper if you don't have insurance. And it blows my mind.
Wow.
Absolutely blows my mind, because you think about folks who are paid, who's reaching a $10,000 deductible before
True.
insurance kicks in, right?
True.
Who's doing that?
Yeah.
Unless you have something going on where you have a lot of medical issues, who's really reaching that?
Yeah. Yeah.
Paying that, I'm paying my premium every month, I'm paying all of these other things, medicine, all the things. So that underinsured piece is a barrier. The exposures, the disproportionate exposures to stress and trauma. So higher rates of discrimination, workplace discrimination, discrimination in perinatal settings as well. And then structural racism that may they may experience in healthcare. So the quality of maternal health care, the quality of mental health care, and how all of these now impact preterm birth as well as low birth weight. And thinking now, taking us into infant mortality rates. So it's not a thing, that we're just talking about this one thing. We're talking about this one thing and how it impacts all around and down the line.
Yeah. We're going to be doing this in two parts.
Okay.
And I want to ask one more question in this first segment, and then we're going to, I'm going to have you back next time for another episode. I want to ask this one question. You mentioned infant mortality rates. Mm-hmm. Talk about the rate of loss of both mother and child for women of color.
Absolutely. So women of color, and particularly Black women, are 3 to 4 times more likely to die from pregnancy-related complications than white women. That, in my opinion, is a pandemic. That is an epidemic, right? That is a crisis.
Wow.
That is a
3 to 4 times more likely not to survive childbirth.
And this is up to first year. So pregnancy and pregnancy-related complications. So whether it's childbirth, whether it's a month later, 2 months later, 5 months later, up to a year later. So perhaps I'm going to my doctor and I'm saying these things and this isn't happening. And there was a heart issue now that wasn't caught, or, any of those types of issues. Was there a maternal mental health issue? And now we are seeing, and I don't know how much I can say without getting it censored, but people wanting to unalive themselves, right?
Yes, yes.
So we think about that. We have to look at that. And so being 3 to 4 times more likely, that is and this isn't just in lower income populations, because I want to always clear that up, because if you're reading certain research or certain bodies of literature, what you will hear and see, what you will hear and see is, oh, well, we're looking at education, we're looking at insurance status, we're looking at housing, we're looking at weight and different social determinants of health. We're looking at all of these things, because those things would say, oh, well, if you don't have a decent or quality education, you're less likely to have a decent job. If you're less likely to have a decent job, you're less likely to have quality insurance. If you're less likely to have quality insurance, you're less likely to have access to quality providers, right? That's the way it would go. So when we understand that these women are still dying at higher rates despite all of that, when we remove that, right? So when they are overeducated, when they are scientists, work for the CDC, when they are in HR, when they are bankers, when they have all of these, what society would consider a good job, right? Which means they got what society would consider good insurance. and have access to quality professionals, they are still dying.
It's still dying.
Still dying. You can
So
go.
those variables that we think would set you up
Would set you
for
up
a different outcome.
Yeah. Put you at a higher risk, right? Because you think about it, there are things that are going to be risk factors. We look at all of that. And that would say, hey, that is going to decrease a person's life, right? Life expectancy. We remove all of those factors and we see that the numbers are still higher. So an overeducated Black woman is with a college degree is still more likely to die than her white counterpart without a high school education.
So there's something about how women of color, Black women especially, are being treated or not treated in the healthcare system.
Absolutely.
And race is not a chronic illness.
Right.
So we can stop saying Black people, race is the problem. Racism is the problem.
Right. And so then that translates to babies. And Black babies and babies of color are just as likely to have higher rates of infant mortality as well than their counterparts. I remember someone telling me, oh gosh, and I want to get their story right. So I hope that I don't misstate this. But she was told her baby was in the NICU. Oh, be thankful you have a Black girl, because girls are more likely to survive in the NICU than boys. Be thankful. Oh, you got a Black girl in the NICU. It was something like that, but it was definitely in that. And I'm thinking, wait, they said what now? And this was a healthcare provider in the hospital. This wasn't a random person who you would not expect to have some cultural humility, who would have some clue about themselves and the words that are coming out of their mouths, right? This was a person in that hospital setting. Now, could it have been that they were trying to give that mother hope, like, hey, statistically, these babies are stronger, more likely to survive? But the way it came out and the way it was expressed was not that.
My goodness. I think it speaks also to the fact that even someone who is trained in cultural responsiveness, or should be trained in cultural responsiveness, can still miss the mark. Thinking about how things come across to for a Black woman or a woman of any racially marginalized community. So when we come back for next episode, Dr. Holloway, I want to talk more about culturally responsive strategies. I want to talk about how healthcare providers and mental health professionals can work to build trust and improve outcomes for Black mothers, and we can even maybe get into some policy changes. You are so knowledgeable. Thank you for this amazing episode today, and I cannot wait to finish this conversation with you in the next episode. And to everyone who is watching, thank you for joining in as we're talking about part one in a two-part discussion on maternal mental health for women of color. I want you to be able to incorporate this knowledge into your multicultural mindset. If you are working as a mental health professional, I hope this episode encourages you to pay attention when you're working with women of childbearing age in general. And also, I hope it encourages you to look into your own practice, look into some research. Dr. Holloway is going to be back with us again, and I hope you'll join us. Come back for part two. It's really going to be just as good as this, and probably even better, if that's even possible.
Definitely come back for part two, because we know the problems. You got to know some solutions. So don't just stop here part one. You need to come back to hearing, how do we work through this now? What do we need to do, and what's our responsibility? Exactly.
Thank you so much. As always, if you enjoyed today's episode, make sure to subscribe. That way you'll be reminded about the next week's episode. subscribe, leave a review, turn those notifications on, and share it with others who might benefit. This is LaVerne Collins signing off. And until next time, keep practicing with empathy, humility, and a multicultural mindset. Thanks for joining us.